We turn to Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. He is on the front lines here in the U.S. response to the coronavirus.
When the current coronavirus pandemic started in the year of 2019, not much was known about the disease. Because of this, healthcare workers risk their lives every day to save others who have gotten sick from COVID-19. I interviewed Angeline to see what her experiences were like while working on the front line during the current pandemic as a nurse.
My name is Angeline. I am 24 years old and I've been a registered nurse for a little bit over a year since December 2019. I knew I wanted to do something within the medical field. I just wasn't really sure which path to take after I graduated high school, but my older sister became a nurse before me, and when I was applying for schools, I applied to one and last minute and I got in, so I just felt like it was the right way to go. But I really like that you're able to help people, and the job schedule is flexible, and there's a lot of diversity within the career, so I really liked all those aspects about the work. When COVID first came out, I was still a pretty new nurse. I had only been working on the floor by myself for like about a month, and then the pandemic hit in March. So I was pretty much learning how to be a good nurse, like on my own, as well as trying to deal with the pandemic. There was like a really big learning curve our hospital had to go to. The doctors were still kind of figuring out treatment day by day, so all the medications that patients were taking were like changing day by day, just as the news and the research came out. But the scariest thing is that a lot of these patients come in like super sick, like they can't breathe, and it was hard to kind of realize like you can't really save all of them. Some of them make it, but some of them, the virus just hits them too hard, and we kind of just have to lay them to rest peacefully. So being a new nurse and trying to learn all of that really quickly in a really short frame of time was kind of hard, and our hospital was really really understaffed at that point, and there was a lot of patients to take care of and not enough nurses, and a lot of nurses left because they were scared, and then some of the nurses got sick with COVID. Now that the surge is down, we don't have a lot of COVID patients anymore. I just feel better prepared now. Now I know what to expect. But yeah, it was pretty difficult the first time around. I would come home so scared for my parents because they're in a higher risk age group, and this is before the vaccine came out. Seeing all the news and everything, it just made me so appreciative of all the healthcare workers that are working, how people are still willing to go to work and help treat these people. I've definitely became really appreciative of all the scientists who are continuously doing research on pandemics and viruses, that we were able to create such a response in such a short amount of time. Yeah, I think it just made me more thankful for life in general. I remember the first time I got a COVID patient, it was definitely nerve-wracking, but thankfully my hospital wasn't really short on the personal protective equipment, so we always had our N95s and our gowns, and I know some hospitals didn't have that luxury, so I did feel protected. I was more so scared for if I were to contract the virus. I was more scared for my parents or any older people that I would come in contact with, because I know my age group has a better chance of faring the virus. Due to COVID, I always wear a mask before I leave the house, and I wear it all the way straight into the unit. Another thing that I wear is we all wear scrub caps now to protect our hair, but pretty much everything else is the same. I wear the same scrubs, but just the mask and the scrub caps would be different that I put on every morning. One thing I do is I take off all my scrubs before I touch anything, and I dump them in the wash and put them in the wash immediately. You know, there's not really any way to know if you've contracted the virus that day because the symptoms don't really manifest for a couple of days. So good thing our house kind of has like separate rooms, so we're able to, if one of us were able to get sick, we were able to, you know, isolate at home. But just wearing my mask all the time if I'm outside, and N95 if I'm at work, it seems to be pretty secure and keeping me like not infected. So I think mask wearing is probably the most important thing I do to help keep my family safe.
Due to how healthcare workers on the front line, like Angeline, see many people struggling for their lives while at work, it has been crucial for her to have hobbies in order for her to take her mind off of work when at home.
It's nice because my job, like, I don't really have to carry any of the work home really, except for, you know, just the emotional labor of it. So I do get the chance to like separate myself from work on my days off. So some things that I do to kind of unwind are, you know, spending time with my family, or spending time with my dog, or spending time with my friends, outside, socially distanced. And just like if I have time to like work on my hobbies, I like to, you know, paint, or I like to sew a little bit, so just kind of keep your mind occupied with things that you like. I got vaccinated last December, so I got the first rollout of Pfizer in the US, which I'm really, really grateful for. And I wasn't scared at all. I was super happy to be getting it. I did have some side effects that felt like flu-like symptoms afterwards, but totally worth it.
Even though scientists and doctors have worked hard to make effective vaccines, there are multiple reasons why we still have to take precautions in order to keep everyone around us safe.
Everything the CDC says is true. Social distancing, at least 6 feet apart. I know we're probably getting kind of old of that statement, but it really works. And wearing your mask is probably the most important thing that you can do. And just reducing the amount of people that you spend with, and like bigger groups. But mask wearing is the most important.